hospitals, nursing homes. Most of us won't be even able to walk, never mind chewing anything. We heard about antibody testing and tracing than ever this week in our state. So we thought it would be very helpful to the public if we had a virtual town hall with academics, researchers, and health experts on antibody testing, tracing, and everything in between. The link of our town hall, which we held right here with there's the notice is on our website, on our Facebook page, Ron Kim NYC, or you could scroll down my Twitter account for the link on the YouTube. It was an hour and a half fundraise virtual event, and we've had a number of positive feedback since. So, why is it so important to create what we call a gold standard when it comes to testing and tracing? Because under these circumstances and post pandemic, we will be as strong as the weakest link. If you're creating political and private markets out of testing, collecting, and harvesting public data while neglecting to take care of the unbanked, uninsured, and undocumented populations, everyone will continue to suffer. In this pandemic and beyond, we are as strong as the weakest link. So, what is the gold standard? It's centering the mass antibody and COVID testing with the patient or person at the end as the main beneficiary of the process, not some third party pharmaceutical lab that's harvesting and monetizing off people's data. It's about designing a technological solution that protects our civil liberties and allowing people to share information directly with each other without relying on any centralized extraction of data and value. This is the only way to build trust with informal sector workers who are very critical to the economic recovery. From delivery workers, street vendors, to upstate farm workers, these individuals need to feel safe that their personal information is 100% private and can't be seen or sold to third parties. This is what we call a self sovereign identity, SSIDs. We have legislation on this gold standard and should have a bill number very soon. Earlier this week, as seen in the picture above, we've also rolled out a mobile testing center in Queens. This is in conjunction with a nonprofit called KAIPA, Coalition of Asian American Independent Physician Association, volunteers and frontline health professionals and doctors to create a phone booth like testing site so we can actually go directly to where the needs are, where the people need the most testing, especially in immigrant communities where people are under tested and they desperately need access to these points. So I'm glad to join KAIPA and my colleagues to launch this, but we should be doing a lot more than launching just a couple of programs here and there. Every corner, every building, every NYCHA building should have access to this test. We were 2 months behind in rolling out the testing programs, which means at this point we have to scale 25, 30 times at a higher rate to make sure that we get to everyone before the second wave hits us. As many are now starting to focus on the economic recovery, New York should also lead the way in putting together a gold standard for delivering benefits to our neediest people in our communities. In a perfect world, we would have already canceled rent, more mortgage payments, while delivering money that could be spent locally and for care work, instead of getting the money taken out of our bank accounts from debt collectors. If we did this, we would have built what I call an economic resilience to COVID 19 and could have leveraged this moment of crisis to build a better economy that works for all. Instead, here's what's happening. To no fault to any of these elected officials, local politicians and aspiring politicians are reduced to being resource brokers, often misleading the public that by securing a few PPE and lunches today is enough. Here, I did my job. I saved you today. Let's take a picture, and you can go thank me on social media. No, it doesn't work that way. Now, most of my colleagues understand what I'm talking about today. People like Assembly members Catalina Cruz and Mike Blake, they're spending every single day putting on the necessary band-aids to stop the bleeding, but they also know that unless we fix the root problem, we're not doing our jobs as lawmakers. So when I deliver PPEs or resources on the ground, I still bow down and apologize on behalf of the state and let my constituents know that our government has completely failed them. This face mask, this lunchbox, whatever is not enough. I tell them, I'm sorry, I'm not a hero. You can thank me if I'm actually helping to fix the situation that we are in now. Now, having said that, the kitchen staff and the workers, the nonprofits, and all the mutual aid groups that specifically help the homeless, immigrants, and other marginalized members who do not receive public benefits, you are all doing God's work, and I thank you for everything you're doing. But for elected officials and political leaders who refuses to tax the rich and the wealthy, and hold bad landlords and developers accountable, but try to come off as a local hero by delivering some lunches, please stop. Why is it so hard to deliver benefits directly into the pockets of the people who need it the most? There are many reasons, but today I'm going to focus on our public benefit system. Even before this pandemic, many of us recognized the problem that immigrant and migrant workers and some of our most marginalized workers, including domestic workers and gig workers, were not receiving any of the public benefits that we intended to give them. So, for example, if we continue to increase tax credits and tax breaks, they weren't collecting them because it was virtually impossible for them to prove the hours that they work when they had 7 or 8 employers throughout the year. This is the premise of why we came up with a solution called the inclusive value ledger, also known as the public Venmo. Recently, our solution was covered by the MIT Technology Review. And in sum, what we have proposed is to make our public benefits as fluid, portable, and fungible as possible on a public payment system. What this would do is allow people to transfer benefits in a seamless way without going through bureaucracies and really be able to create another layer of local currencies where we're transferring and exchanging value at a much higher rate than we're doing now in our rigid system. So let me just start off by how, as I give some updates on nursing homes, how a public Venmo or a portable and fluid public benefit system could immediately impact people on the ground, starting with our nursing homes. Medicaid is a good example how the system is completely structured in a way where people that deserve to get all the benefits are not receiving it. So, case in point, um, most of my constituents who are still stuck in nursing homes, exposed to COVID-19, or some of them are actually positive, aren't able, and many of them and their loved ones and their families, they would want to bring them back home. um, you would think that that would be a very easy process by merely just taking the money that we're reimbursing them on Medicaid at nursing homes and transferring that benefit to home care, which is what a lot of these families want for the next few weeks to protect their loved ones. So you would think, hey, here's a pot of money that we're giving out through Medicaid and nursing homes for my grandmother. Now I want to take her home. Can you transfer that benefit to a home care specialist that can come and take care of my grandmother at home while we weather this horrible situation? It is impossible to just do that because of how our system is designed. We have to go through the federal government. We have to introduce a number of bills to change the regulations on Medicaid. Um, so we have no choice but to come in and rely on the Department of Health or local government agencies to to grant that wish to transfer out the patient who may be in jeopardy or exposed or not being taken care of to a better facility or work with us in bringing them back home. Luckily today, the Governor Andrew Cuomo has listened to our calls and more or less shifted gears and directed the Department of Health to do precisely that, which is help those families that want to transfer their loved ones who they feel are exposed to infections or not being taken care of nursing homes right now. So I want to thank the governor for clarifying that point at today's press conference. And I look forward to monitoring how the State Department of Health will execute his order in the next couple of weeks. Again, this is one of many solutions that we're offering as temporary band-aids to get through this crisis in the nursing homes for the next several weeks, and as we prepare for the second wave. I have legislation that we drafted in conjunction with the speaker's staff, and we will be introducing sometime this week with more details and measures to protect our nursing homes. I look forward to working directly with the governor's office as well on these measures. Um, but again, a lot of them is just band-aids to stop the bleeding and making sure we can immediately save lives. The long-term problem that we're dealing with when it comes to nursing homes are the years of underfunding and the privatization that left nursing homes as profit-driven businesses, not care-driven organizations. That is the core problem that led to this point where people are constantly have undercut services in our nursing homes, fought against standards of making sure that we have enough staffing beyond nursing homes. We have some member Gunther in our legislature who championed bills to have the right ratio of staffing in nursing homes, which was rejected for years by the industry because, two, they felt they did not get enough support, government funds, and secondly, it's a profit-driven private model. So, why do I bring these points up? Because right now, as we are dealing one of the worst shortfalls in our budget. The governor and his team just announced that we're facing up to $13 billion deficit because of COVID-19 as a state. We instead of micro focusing on trying to figure out how do we raise more revenue in a time of emergency crisis by leaning on those who are better off in our state, the wealthy, the ultra millionaire class, who are, for the most part, are more than happy to step up and pay a little more in the interim to make sure that our state can recover from this crisis. Instead of focusing on those things, our governor and our mayor is exclusively focused on cutting programs left and right, and expanding a austerity minded culture in our state. So when the economy was doing well, we still had an austerity budgeting mindset. We had to fight tooth and nail for years, even when the economy was thriving, to meet the minimum amount of money for our public schools. Even though 10 years ago, through the Campaign for Finance Equality (CFE), the highest court in the state of New York said that our classrooms are deserving of multi-billions and billions of dollars that they deem that they should be granted. It's been over 10 years, and we still are behind, I think, $4 billion from that settlement. So my point is, even when our state were doing well, we still could not manage to take care of our classrooms, our nursing homes, our hospitals. Now that we are really struggling and we need to invest a lot more into the care sector, and from education to nurses and hospitals and doctors and everyone in between, we are pushing together. We're putting forward more austerity budgets, cutting into our most vulnerable populations, when it is completely reckless and foolish to do that in this moment. Two things. First, again, taxing the wealthy class. We have at the legislature over 16 or 17 bills. So these are well thought out measures, closing some of the loopholes in the financial sector, in real estate, all the things that over the years that these industries have put forward to game the system. We're just going to undo some of them to create billions of dollars of revenue. They spend years, 10, 15 years, these industries, collecting hundreds and billions of dollars from our state. We can close some of these loopholes to make sure that the revenue comes back to us. We can lean on, again, our wealthy class to do a little bit more to make sure that our city and state are in a healthier place. Secondly, and this is something that we'll go into more details at a press conference tomorrow with a number of advocates, the Federal Reserve has given us a gift for the first time in a way that they've never done so before, which is essentially deputizing localities and states to act as de facto federal governments, meaning we are in a position to actually co-design how the new money through the quantitative easing or monetary easing process could be printed and allocated. Instead of waiting around the central banks for the money to trickle down, which it never does, we are essentially in a place where we can actually, for lack of a better word, print new money with the government. What does this all mean? This means that there is absolutely no reason for us to continue in the austerity budgeting process. At minimum, we have we can borrow money from the Federal Reserve and the funds that the Federal Reserve is setting aside for us. And secondly, we just need some political courage to come up with new revenue streams by leaning on the wealthy class of New York. All this is possible. We just need some political courage by our leaders, by our executive leaders, our governor, our mayor, the speaker, the majority leader, to really step in and work with us in putting these ideas and proposals together. Because the alternative, as you've seen the outcome of years of underfunding and austerity toward nursing homes, and that led to the privatization of these facilities, has resulted in. Imagine that multiplied by 10, 20 times if you don't act now and do the right, implement the right policies. With that, let me just make a couple of announcements for tomorrow. We have our virtual weekly town hall meeting tomorrow night at 8 p.m. with the APA task force. This is our third uh, virtual town hall with my co-chair Yunlin Nyo and our executive director Kai Zhang. We launched the series to address the rise of hatred and hate crimes against Asian Americans even before the pandemic hit the U.S. starting going back in January when people started boycotting and targeting Asian American small businesses. We've launched a series to build solidarity around Asian Americans and Asian American issues. The first two meetings we've held, we did with the Black and Hispanic nonprofit, grassroots, and community leaders. Tomorrow night, we will be hosting our virtual town hall with the city of New York and various city agencies who are aligned with our mission to build long-term solidarity for Asian Americans in our Asian American communities. So please tune in at the APA Task Force Facebook page. We will also be sharing the link to our Zoom in the next few hours and tomorrow as well. And hopefully, I'll see you tomorrow night. Thank you.